There are two ways how to get midwifery education in Latvia. First level professional college education, where in 3-year studies midwives get the qualification to work successfully providing antenatal, maternity, postnatal and newborn care in primary or secondary healthcare system, or work together with a gynecologist, obstetrics, or work independently. A second option is professional bachelor studies, where in 4-year studies midwives have a qualification in family and society, sexual and reproductive health, to organize and manage maternity care, successfully work to provide antenatal, maternity, postnatal and newborn care in primary or secondary healthcare system. They can work in hospitals, private clinics or independently. Midwives in Latvia work in healthcare institutions and organizations of various profiles, or they can be self-employed. Midwives take care of the sexual and reproductive health of a woman, her family and society. They provide antenatal, pregnant, maternity, postnatal and newborn care, manage and take care of physiological pregnancy, childbirth and postnatal period, participate in medical treatment, organize and direct maternity care, educate patients and society, also members of the care team, as well as promote the development of their profession and obstetric work. The midwife systematically improves her knowledge and skills. The private clinic, the heart of the family, offers such services as gynecological care, medical ultrasound, gynecological for abdominal cavity, for breast, for thyroid gland, for urinary tract, help for those couples with decreased fertility by identifying the factors that cause infertility, their prevention, treatment, the correction of the couple's lifestyle, and nutrition to promote the possibility for the couple to conceive a child naturally. Also offers prenatal care checkups at 3 midwives, prenatal care checkups at 1 gynecologist for those with high-risk pregnancies, also offers postnatal care, and how we are different from others. The work of the clinics is based on Christian values and on individual, deliberate and holistic care. Clinics offer planned homebirth service, psychological support for those women who have miscarried or who have had medical abortions, and for those families who have lost a child. Support and care for those pregnant women whose fetus has been diagnosed with some pathology and who have decided to keep their baby. Education and training for families about natural family planning using the Sympto-Thermal Method. Education of the society by creating different informative videos that include sexual and reproductive health topics. Midwives provide high quality, efficient and individualized antenatal, maternal, postnatal and obstetric care. Quality and efficiency are achieved by making well-balanced agreements that are based upon scientific evidence and consensus forming by the various professionals involved in obstetric care. The main aim is to provide the risk selection within the field of obstetric is carried out appropriately. The primary care provider, midwife, is primarily responsible for this process of risk selection, but the final decision is made by our clinic's gynecologist. The medicalization of obstetric care in midwives' work should be as more as possible avoided. Based upon this assumption, alongside low-risk and high-risk hospital deliveries, Homebirth must continue as a viable option. Care during normal pregnancy, birth, and postpartum is considered to belong to the group of primary level obstetric caregivers. The main basic assumption is that pregnancy, labor and birth, and postpartum are physiological processes that can take place at home. Pregnancy, birth, and postpartum selected by the primary level care provider as being at risk belong to the secondary level care provider field of work. Our midwives use decision-making structure. The responsibility for obstetric care in low-risk pregnancy and birth is with the primary obstetric care provider, its midwife. If consultation situation arises, this is a case of evaluation involving clinic's gynecologist or secondary care in hospital. Under the item concerned, the individual of the pregnant woman will be evaluated and agreements will be made about the responsibility for obstetric care. It is a situation where obstetric responsibility remains with the primary care provider, but in the specific situation it is necessary that birth takes place in a hospital in order to avoid transport risk during labor and birth. There I want to show you midwife's home birth equipment. A childbirth is an event that changes a person's life, and the labor care can affect her both physically and emotionally, both short-term and long-term. A good communication, support, and compassion from a midwife who can notice a woman's needs and wishes can promote a positive labor experience. A woman is in the center of midwife's model of care, and childbirth is perceived as an essential healthy process, and a mother and the child as a whole. Research shows that in midwife's model of care, 85 to 95% physically healthy women can safely give birth to their children. Midwife's model of care includes natural birth without medical interruption, except the occasions when it's really necessary. If we talk about physiological or natural birth, it refers to a full-term pregnancy, at least full 37 weeks, when labor starts naturally. It's not initiated, and it ends with a vaginal birth without using medical instruments. And both mother and newborn are healthy. During a planned home birth, there are no limits for birthing positions and places. For example, it can be the bed, the floor, or the bath or birthing pool. During a planned home birth, the midwives are trained and prepared to help giving birth safely at home. And if necessary, they can also recommend to continue the birth in a hospital. Maternity care, pregnancy, labor and birth, postpartum, is paid from the state budget. It includes gynecological checkups, laboratory and diagnostic examinations at specific weeks during the pregnancy. Prenatal care is done by practitioners who have signed a contract with National Health Service about prenatal care. State-paid childbirth is possible in those medical institutions that are in contractual relations with the state. Those that have signed a contract with National Health Service. All hospital births are paid by state. If a woman wants to have a prenatal care provider who doesn't have signed a contract with National Health Service, then she has to pay all the bills on her own, including prenatal checkups and any other examinations. A planned home birth is paid by the individual woman only, but some insurance companies offer to cover part of the costs.